Before diving into the specifics of concussions, it's essential to recognize the broader context of brain health and injury. Understanding adolescent concussive trauma involves recognizing both concussions and subconcussions as significant brain injuries. These injuries arise from impacts, whether from sports, accidents, or other activities, and we must take them seriously. The journey of the Mac Parkman Foundation began with the tragic loss of Mac Parkman, prompting a deeper investigation into how these injuries affect young lives. Despite the initial focus on acute concussion symptoms, the real impact lies in the long-term effects of both concussions and subconcussions. When Mac experienced his concussions, the mistake was not in the acute management, but in the lack of comprehensive follow-up. While coaches, trainers, and medical staff were skilled in recognizing immediate signs, they often lacked the training to manage post-concussive disorders or to consider the cumulative effects of repeated impacts. Mac's concussions occurred in different sport seasons and were compounded by his reluctance to discuss their growing impact on his psychological well-being. Despite adhering to recovery protocols, the combination of multiple concussions and ongoing subconcussive trauma contributed significantly to his struggles. A concussion is a type of traumatic brain injury, TBI, caused by a bump, blow, or jolt to the head or a hit to the body that causes the head and brain to move rapidly. This sudden movement can cause the brain to bounce around or twist within the skull, leading to chemical changes and potential damage to brain cells. Young athletes are particularly at risk, with concussions occurring frequently in organized sports. In the U.S., almost 90% of football-related traumatic brain injuries happen in adolescents aged 5 to 18. Sports-related head impacts are second only to road trauma as a cause of TBI among older adolescents. The incidence of concussions reported by high school students has increased by 15% annually over the past decade. Subconcussive impacts are not as detectable as concussions. The brain is shaken, but not so violently that the damage to brain cells is severe enough to see through symptoms. Examples include tackles and collisions in football, headers in soccer, checks or collisions in ice hockey, body checks in lacrosse. These impacts may not cause immediate symptoms, but over time they can lead to cognitive decline and mental health issues. Chronic exposure to both concussive and subconcussive impacts can contribute to severe conditions like chronic traumatic encephalopathy, CTE, and may result in self-harm or suicidality. This is an essential point for you, the parent, as while every child may not suffer a concussion, every child who plays contact sports will suffer subconcussive exposure. Young athletes, parents, coaches, and medical professionals must take concussions and subconcussions seriously. Education on these issues is vital, as many people within your trust network may not fully understand their long-term impact. Continuous communication and monitoring between the child, parents, coaches, trainers, and staff, even between schools when the child moves, is essential to ensure a full recovery and prevent further injury. You will find that just from consuming this content, you may be more informed on subconcussive risks than most coaches, athletic trainers, and medical personnel, which will be critical to the long-term health of your child athlete. Professionals we have consulted with are adamant that the continued exposure of Mac's injured brain to subconcussive trauma for 10 months a year since the age of 6 is what contributed heavily to his mental illness. However, that same network of coaches, trainers, medical professionals, and parents did not know that returning to sports, even after passing his evaluation, could have had such a negative impact because of subconcussive trauma. Mac's experience underscores the importance of understanding the risks of both concussions and subconcussive trauma. His case illustrates how ongoing exposure to subconcussive impacts, even after recovery from concussions, can have severe long-term effects. Awareness and training in subconcussive trauma are lacking. There is no standard medical diagnosis for subconcussions, making it difficult to gauge their severity and cumulative impact. The Mac Parkman Foundation advocates for increased awareness and training to address these gaps. Post-concussion syndrome, or PCS, involves persistent symptoms beyond the typical recovery period of about 2 weeks. Symptoms can include concussion-like effects at rest or during physical and cognitive activities, potentially disrupting daily life. If your child or teen has concussion symptoms that last weeks to months after the injury, their medical provider may talk to you about the post-concussive syndrome. While rare, after only one concussion, post-concussive syndrome is more commonly believed to occur in patients with a history of multiple concussions. We can't talk about concussions and subconcussions in sports without mentioning chronic traumatic encephalopathy, or CTE. CTE is a condition linked to long-term exposure to concussive and subconcussive injuries and can only be diagnosed post-mortem, though research is underway to identify early biomarkers. CTE is associated with severe emotional and psychological effects and is heavily documented in professional league players, though it has now been found in athletes as young as 17. Post-concussive syndrome follow-ups and subconcussive impacts are critical issues for any family that has a child with multiple concussions or that has years of subconcussive exposure to contact sports. If conditions are not properly managed, monitored, or identified, the associated symptoms can progressively worsen over time. The signs of any type of concussive trauma are many, that is, sleeping late, sleep deprivation, light sensitivity, apathy, and more, and as we have said, mostly replicates some of the expected actions of maturing young men and women. Given the insidious nature of the progression, children with multiple concussions must spend time with the therapist to evaluate them at least once a year for any indications of the physiological and psychological signs of any progressive illness. Conversations with clinical psychologists show most adolescents may not talk to their families about mental health issues, and in Mac's case, even his closest friends. However, children may open up in conversations with an impartial third party. But to determine if your child is suffering, they must talk to someone to unload or discuss their issues. Regular evaluations by therapists and clinical psychologists are essential to detecting and addressing these conditions early. Mac's story highlights the importance of vigilance and education in managing brain health for young athletes. Awareness and proactive measures can significantly improve the prevention of long-term damage and the outcomes of children in contact sports.